Seated blood pressure technique. Blood pressure in the clinic is most often taken in the seated position. Now, similar to other concepts related to blood pressure measurement, the use of standardized technique is critically important to ensure accurate and reliable measurement of blood pressure. In the following, we will describe the steps for seated blood pressure measurement. Step 1. Choose the right cuff size. Cuff width should be slightly greater than the diameter of the person's arm. There are several options available for different devices, and clinicians should use the line as an indicator for the appropriate fit. The lowest edge of the cuff should be at least 1 inch above the antecubital fossa, so the diaphragm of the stethoscope can be placed over the strongest point of the brachial artery. Remember, if the cuff touches the stethoscope, noise artifacts will be generated. For more information on how to choose the right cuff size, refer to our video on cuff sizing. Step 2. Position the patient correctly. The patient should have been resting for at least 5 minutes in the chair with their back supported, feet flat, and legs uncrossed. The arms should be at the level of the heart and supported to minimize muscle activity. For more specific information on patient positioning, refer to the video on patient positioning. Step 3. Placement of the stethoscope. Place the diaphragm of the stethoscope over the brachial artery, which is medial to the tendon of the biceps brachii muscle. It's also important to use a high-quality stethoscope. Lower quality models or those with long tubing may lack good sound transmission properties, making it difficult to perform accurate auscultatory measurement. Step 4. Inflate to the correct pressure. For most individuals, a pressure of 180 to 200 millimeters of mercury should be sufficient to exceed systolic blood pressure in order to allow for accurate measurement. However, there are some instances where that might not be the case. We'll demonstrate techniques which can be used in those instances in another video. To inflate the cuff, turn the dial to the right and begin to inflate by squeezing the pump or the bulb. Step 5. Slowly deflate the cuff. To deflate the cuff, turn the dial to the left and begin to deflate slowly. The rate of deflation should be roughly 2 millimeters of mercury per second. Deflation rates faster than 2 millimeters of mercury can lead to a significant underestimation of systolic blood pressure and an overestimation of diastolic blood pressure. It's also important that you do not leave the cuff fully inflated for greater than 10 seconds. Step 6. Measuring values. Systolic blood pressure should be recorded as a pressure at which auscultatory pulsations are first heard while deflating the cuff. These pulsations sound like tapping noises and are rhythmic in nature and are generally at the same pace as the heart rate or pulse rate. The emergence of sound is called the first Korotkov sound. Many people mistakenly use the pressure at which the dial begins to oscillate. While this is tempting since these oscillations of the needle and the first Korotkov sound tend to occur simultaneously, this technique is not accurate. The disappearance of the oscillatory pulsations or at the onset of silence is the diastolic pressure. This is called the fifth Korotkov sound. The silence is due to the return of laminar flow into the brachial artery. The laminar flow that normally occurs in arteries produces little vibration of the arterial wall and therefore little to no sound. However, when an artery is partially constricted, blood flow becomes turbulent, causing the artery to vibrate and produce those tapping sounds, which we hear in auscultation. For young children, the fourth Korotkov sound, which is the muffling of sounds prior to silence, is used for the diastolic pressure. Now, this technique requires a trained ear and practice. In most instances, the fifth sound is used. However, the most correct technique would be the fourth Korotkov sound. Step 7, recording values. It's generally recommended to record the blood pressure to the nearest 2 millimeters of mercury. Regarding number of measurements, now there is no specific number for the number of measurements you should take. However, it's generally recommended that you take at least 2 for new patients. However, if there's a difference between 5 millimeters of mercury between the first and second recordings, additional readings should be obtained, and then the average of these multiple readings is used. It's important to note that the readings must be taken at least 1 minute apart from each other. For more information on the interpretation, refer to our video on normal and abnormal values and our additional resources on clinical decision-making for blood pressure. Thank you.